immune system is more powerful than we could imagine and can absolutely fight cancer.
Yes.
The problem that most of us have is that cancer can cause immunosuppression. So if we can revitalize these things, the immune system can be absolutely an incredible ally and kill cancer on our behalf.
Welcome to Hormone Heroes, where I share testimonials from real people who have experienced bioidentical hormone therapy. Men and women share the symptoms they have experienced and the difference proper hormone replacement has made. I'm your host, Dr. Kelly Hopkins, and I have been in the functional medicine space for over 30 years, with a focus on hormones for 20 years. Please keep in mind this podcast is for educational and entertainment purposes only. Please consult with your physician or practitioner for medical advice. Let's get started with today's guest. To have Rusty Roberts with us. He is a cancer patient advocate and a former founder of an integrative oncology clinic, and he has spent more than a decade helping cancer patients and their families navigate complex treatment decisions. I think, Rusty, the service you're providing people when they're frightened, they've gotten a diagnosis that's so scary, you help them and their family make the right decisions. So welcome, Rusty.
Thank you for having me on, Doctor. Appreciate it.
Yeah. And you are located out in the Phoenix area?
I am. It's good and hot. Good and hot.
Yeah, good and hot. What's your high today?
I think it's cooler. I think it's only going to be about 107 today, but it can get 116, 117, right? Yeah,
right.
It can get really warm out here.
And like they say, at least it's a dry heat. Like that matters, right?
Well, we're in the monsoon, so lots of rain and the humidity goes up.
Yeah.
So, yeah, that's the summers for us, though.
Wow. I know your mom had lymphoma. Tell us how you got into this line of work and
Sure.
Just give us your background.
Sure, absolutely. It all started with an absolutely incredible and frightening journey that my mom went on in early 2007. She's about 58 years old, totally healthy, normal looking, but had a few kind of strange symptoms throughout that year leading up to it. But then she had a bump here come up. They biopsied it, found cancer right away, sent her over to an oncologist. He diagnosed her as late stage 4, 12 weeks to live. I mean, she looks totally normal. All of a sudden, you got 3 months or less to live, unless she took aggressive chemotherapy. She opted to do that. It did not go well, doctor. It did not go well at all. On her very first diffusion, half her hair fell out, blisters on her head, her mouth and throat, and she was just miserable. But the next week, they connected her to another bag of CHOP Rituxan, and it stopped her heart in the infusion chair right there. Praise God, they were able to resuscitate her. They flushed her out and just said that there wasn't any options that medical science could provide for her. Go ahead and prepare to pass on. The next 2 weeks were absolutely grueling as she lay in bed, rapidly fading away. I watched her age 58 to probably looking above age 90 in just 14 days.
Wow.
And she actually made the room smell like dead flesh.
Yeah.
And I didn't understand how that could be, but that's what the room smelled like. And my dad didn't give up on her. He was desperate to find a solution. He did find a referral in a book, and he called that clinic up. They gave him hope. He loaded her in the car basically on the spot, took her down there. He knew she didn't have much time. 2 weeks at this clinic, doctor, 2 weeks. She's wheeled in a wheelchair, 2 weeks to walk, walks out on her own 2 weeks later, has a PET scan. All the tumors are gone.
Wow.
She goes on to live another 12 years. It's everyone's dream come true, right? How does this happen? Yeah, the doctor, we asked him, how'd you do that? He didn't know. He couldn't tell us. But he took credit for it. Her oncologist here that she went to, her conventional oncologist, he said he would have just thought she was misdiagnosed, but he had seen all of her pathology and knew. He just chalked it up as a miracle. It took some time to find a doctor who said, I know exactly what happened to her.
Right.
And of course, I was all ears. He said, yes, she did receive a miracle, but it was rooted in science. And there was clues all along the way, and it's just a rare thing that most doctors are not going to pick up on. The first clue was that her head blistered, her mouth and throat blistered. These blisters show that the immune system, she's had allergic reaction. The allergic reaction is called bullous drug reaction. It's very rare and it's extremely serious. What it does is it can ignite the immune system, kick it into hyperdrive. I just called it berserk mode. And it just started annihilating their cancer so rapidly in the 2 weeks following that the cancer dying was the smell of dead flesh. That's what that was. And the reason she aged so quickly is that the cancer's dying so quickly, she's overloaded with toxins. She's basically dying of toxic syndrome.
Yeah.
She gets down to the clinic. They didn't need to kill any cancer. By the time she got there, all the cancer was probably already dead. 22 tumors just gone. 22 tumors.
Wow.
So they stopped the runaway immune response by, the typical therapies they give any cancer patient, stops that runaway immune response, flushes out all of the toxins. They build her system up, vitamins, minerals, amino acids, and she springs back to life.
Wow.
And goes on to live an extra 12 years. What a blessing. So she left behind that miracle of how that happened, left behind a great lesson. The immune system is more powerful than we could imagine and can absolutely fight cancer.
Yes.
The problem that most of us have is that cancer can cause immunosuppression. So if we can revitalize these things, the immune system can be absolutely an incredible ally and kill cancer on her behalf. What a great legacy that she left behind.
Right. And, all of us have cancer cells roaming around, but hopefully our immune systems are strong enough to fight it off. And that's a great story. So you got to have your mom 12 years more.
12 more years. Yeah,
wow.
12 more years. And her story gave people hope and a way to seek out new options.
Yes.
And we still do that today. We still do that because there are other options. And when a person we just simply, doctor, we don't know what we don't know, right?
Right.
And when we don't know it, we can't take advantage of it. And it's not there to give us hope. Her conventional oncologist, I don't think he didn't lie to her by saying there was nothing else that could be done. It's just nothing else that he knew could be done.
Right.
And
he was using what was in his toolbox.
Correct. And he's out of tools, right? He's out of tools.
Yeah.
So for her, she found inadvertently, she stumbled into a very powerful form of immunotherapy. And doctors are using that safely today in revitalizing and helping our immune systems recognize and fight cancer today. It's quite incredible.
So your mother did 2 rounds of chemo? Just two.
It wasn't even fully 2. One in a portion. The sequence of that, doctor, was that the chemo did not kill the cancer. There was never enough for it to do it. But what it did was it ignited an allergic reaction. The allergic reaction sends her immune system into hyperdrive. The immune system kills the cancer so rapidly, she's dying from toxic syndrome, and then the natural therapies come in, stop that. So it was definitely threading the needle at 100 yards, no doubt.
Sure.
And that was the miracle. She didn't have much time. And many people that actually do get this bullous drug reaction pass away from the body attacking itself.
Sure.
So for her, praise God, she was able to stop that runaway immune response in a short period of time. And it just a sequence of events saved her life. It was absolutely incredible.
So based on your mother's story, that has inspired you to, number one, have your own clinic for a while, and then to start Brio Medical. It's Brio, Brio, medical.com.
Correct.
And you guys are cancer patient advocates. Tell us a little bit about what you do at Brio.
Sure. There's not a lot of doctors that have dedicated themselves to go up and beyond to learn integrative oncology methods. It's a short list. So with that being the case, I had a parting of ways with a medical director, and I didn't want to compromise people's care by just having anyone there. So I opted to go ahead and close the clinic. And it was a painful experience to do that. But during that 13 years that I've been doing this, I certainly knew which doctors I would trust with my own life or
Sure.
our family's life. And so I simply help people match up what their cancer type to a type of a pathway that's available to them. And then if appropriate, I'll make a introduction to a doctor that I would trust with my own care, that if I was in their shoes. So it's a great place to be, and Brio Medical is still a valuable resource today. It's got so much great information over there to help people with and finding those pathways. And I don't make it hard to connect with me and have a conversation with people. It's pretty simple.
Yeah. And so tell us your best candidate for someone that you would be able to help. Who would be someone that should really seek out Rusty Roberts?
First of all, you got to have hope. If you have hope in you, that's the foundational. You want more time? That's the first thing you need. If you want to fight and you want a new option and you have that in you, that is a character trait that we find all the way across the board. Everyone has that seeks these out. Secondly, if a person is still able to eat, use the restroom on their own, they're functioning pretty independently, because a lot of these clinics that do this are outpatient. Not all of them. So we need to know what kind of physical condition the person's in. We need to know the cancer type. The cancer type, whether it's blood cancer or solid tumors, is extremely important, because the options on natural options or holistic options are different. Depending on what type of cancer they have. Predominantly, the cancer types that we see would be breast cancer, colon cancer, prostate. There's pancreatic cancer that we see, and they can be even stage 4, and there's still success. There's still success there. And if a person has been given little to no options, or they're not seeing success with conventional therapy, hey, there is hope here. There is.
Yeah.
It does depend on the cancer type, on the level of success. It can vary, but we are seeing success across the board. Absolutely.
And give us an idea of types of treatment someone could expect.
A great question. Okay, so if, let's say we have a breast cancer patient, right? It's predominant. It's happening a lot, unfortunately. There's 2 pathways that they could choose. One would be a holistic form of chemotherapy. Right? How this is done is, instead of just giving someone this huge bag, maximum to tolerate, right? They can't take any more chemo, and that's typically what we see in conventional. But what they do instead is they will give the patient an infusion of insulin first. This is extremely important. It's called insulin propitiation therapy. And the reason to give a cancer patient insulin is to drive the blood sugar level down that's available in the bloodstream. The purpose of that is cancer's hungry for sugar. So it will naturally lower its defenses to go out and scavenge for trace amounts of glucose in the blood.
Okay.
Right moment, the doctor will infuse a glucose-based chemotherapy agent. It's typically maybe 10, 15, 20% of a full dose, and cancer has a tendency to really gobble that up. It is fantastic. And so we're seeing success with that, when typically maybe a full dose chemo couldn't get in. Low percentages got into the cancer cell, and then there was high toxicity to healthy cells. Versus with insulin being infused first, hey, we're getting a lot more chemo directly into the tumor and seeing success that way. So that is the first pathway that we see is working, and that's called insulin propitiation therapy. You can learn more about it on our website. It's a great resource. The other method that we're seeing great success with in solid tumors and in blood cancers is the pathway that my mom accidentally stumbled into, and that is immunotherapy. That's where they're actually extracting immune cells from our bodies through blood draws, cultivating those cells, enhancing their cancer killing capability. What they're doing is overcoming immunosuppression, and then they reinsert those back, reinfuse those back into the body, and they're seeing just wonderful success, especially combining in certain areas. We can actually combine insulin propitiation therapy with immunotherapy, and we're seeing fantastic results that way. And these are really high quality of life. They're low toxicants on the body. There's low toxic burdens on the body. People are having success these ways. And they're thriving through those therapies, and they're having a much higher quality of life. These are fantastic. Now, there's one third option, which is just using all of just natural holistic methods. Like typically we'll see patients doing high dose vitamin C. They could be using repurposed medications like ivermectin, menbendazole, artemisinin. These are all IVs that doctors can give them that can enhance chemotherapy and radiation. They protect healthy cells, and they even fight cancer naturally on their own. So those can be coupled together with a conventional oncology. If a person wants to stay with their conventional method, they can bring in a support package. It's really helps a person thrive through those. So those are the three pathways that we're seeing people have success today. People need to be their own advocate, doctor.
Sure.
They really, really do. If we just go along with, and I'm not against conventional oncology. I see wonderful things there.
Sure.
But if a person's struggling to thrive or see success and their cancer has continued to progress, you need to be your own advocate and look into these. And that's where Brio-medical.com is a great resource. Conversations I have with people can help zoom them through a process pretty quickly.
Yeah. So, and I just wanted to revisit, you mentioned high-dose vitamin C IVs, ivermectin, and then what was the third one? Artemisinin?
Artemisinin, yeah. It's comes from a wormwood, and people are getting IVs of those, and they have anti-cancer properties. So quercetin, curcumin, all of these things are ways that we can fight cancer from different perspectives. They need to be timed right, dosed right. It's very personal to the person. They need to be sequenced with other therapies to enhance each other. They're kind of certain therapies are grouped together. So those need to be done by a skillful doctor. It's more difficult to fight a cancer, especially when it's late stage 4 orally. It becomes more difficult. And we need to use predominantly, those are done through IVs, so you can get much higher levels of dosages into a patient. For instance, vitamin C. If we just keep taking vitamin C, now we're talking about doses in one bag of 50,000, 75,000, 100,000 milligrams in one setting. It's impossible to do that. It's impossible to do that orally. The body will down-regulate what it allows in the system, and the person, as they get more, try to get more and more vitamin C in them, the body will just stop absorbing it, and the person hits a diarrhea threshold, and it's not a very comfortable experience, right? So to bypass that, then we look at, we do it through an IV, and we can get those therapeutic levels of vitamin C that actually have anti-cancer properties, enhance chemo, enhance radiation therapy, and protect those healthy cells. It becomes a staple when we get into high doses, 50,000 and up.
50,000.
Yeah.
50,000 milligrams.
That's correct. Yeah.
Okay.
And you need a skillful doctor to do that. Somebody who understands how to do that.
Sure. Yeah. Tell us about what's EBOO therapy.
EBOO. Okay. EBOO is fantastic. EBOO. EBOO is a wonderful therapy where they extract a portion of blood from a patient. They run that through some incredible filtration. And if a person's got a lot of toxins, cholesterols, and things in their blood, it will filter those out and super ozone that blood and then reinfuse it back into the body. It usually makes a person very tired. It takes more than one session to really start feeling the effects. But EBOO is a fantastic therapy, and you can get that in very select locations.
Okay. Yeah. So that would... I've heard really great things about ozone therapy, and I see that you've used an ozone sauna before as well.
You can infuse ozone into the body. You don't breathe it. Oh, you don't want to breathe that O3. It'll destroy lung tissue. Don't do that.
Right.
But we could absorb it through our body. We can get it into our bodies through rectal insufflecation, through blood. They can infuse ozone into the blood and then get it back into the body. It has anti-cancer properties, anti-disease. It's a fantastic way of. It's another tool. It's not a magic bullet, but it's another tool to fight cancer from different angles. Yeah, absolutely.
Okay. Are there any other therapies or treatments that are kind of would be a surprise to hear
stand
about?
out? Hypothermia is a big one.
Hyperthermia?
Yeah. Hypothermia, it is scientifically proven that once you can get the tumor above 106 degrees and hold it there for about 45 minutes or more, multiple sessions of that, you can actually damage the DNA inside of cancer cells to where it cannot replicate. It's absolutely quite impressive with what they can do.
And is that done through a sauna or?
When a person goes whole body hypothermia, it's harder on the body because that may be a sustained 2, 3, 5, 6 hour treatment of 125 degrees or more. So when you're looking at whole body hypothermia, it's not easy to do. You might want to sleep through that.
Yeah.
It takes that, if you're going to do whole body, it takes that to get the tumor, because you got to get the tumor to above 106 degrees and then hold it there. So there are certain places that do whole body hypothermia, and there's others that do localized hypothermia to where it's easier on the patient, where they're just driving heat deep into the tissues to get that tumor above 106 degrees. So you're not going to do this just at a med spa.
Right.
They don't get to a therapeutic level. At a med spa, you can get to increasing the immune response. It absolutely can. Hypothermia can do that. But if you're going to get to an oncology level hypothermia, you're going to do that at select locations. I'm happy to have conversations with people depending on what their needs are. Yeah. And what they can handle.
And I see other therapies on your website that are just so interesting. But the point of this conversation today is that Rusty is the expert at connecting patients to the correct treatments and the correct physicians and things like that. So,
yeah.
And I just think that's such a valuable service that you could be an advocate or a connector when people are frightened like that. So and I just wanted to mention, I saw on your website that you even help people consider their financial options to pay for treatment, and you even have connections where people can stay certain places. And I mean, you have the whole package for people and their families to seek treatment.
These cancer clinics are what I would call a destination clinic. There's clinics all over the country, but the state laws can make it prohibit doctors from doing therapies that can honestly help people. So it depends on where you go. So we just have a basic conversation to find out what a person's, the cancer type, what type of therapies that could potentially help them, their individual needs as far as where they're at in their journey right now, but also their ability to travel. How long they could stay. Financial concerns are all in there. So, yeah, it's an individual journey, and a lot of times they just need a helping hand along the way.
Sure.
Because if you're going to learn to be a great advocate for yourself, it takes time. And when we hit stage 3, stage 4, time is not what we have. We have to make some very, very decisive, confident decisions. There is no guarantee, right? Everyone's different. We're not rotating tires, right? I mean, we're talking about complex biology, right? But then there's doctors that have been doing this exceptionally well in different areas of the country and abroad. Not everything can be done here. So some people may need to go to Mexico. There's clinics that were started by Americans up here that are actually down there, but not everybody wants to go to Mexico. I remember I've asked this question to countless people over the years. Down in Mexico, what was your number one challenge getting here? And predominantly, they said family. And family was against it, right? I mean, we're up here in the U.S. We believe in our U.S. System, and there's a lot of great things that happen here, and there are great clinics here. But sometimes it's difficult to fathom that, hey, that stage 4 treatment may be outside of the U.S. So
yeah,
I don't necessarily lead everybody there, but it's an option that people should be considering. But there are clinics up here in the U.S. that are doing a great job as well. So it's just an individual conversation, find out what their personal needs are, what their capabilities are, what their preferences are, and then connect together with a great doctor.
Yeah. So what are some possible pitfalls that someone may encounter?
I have seen this, by the way, that's a great question. It really is. I have seen people in my own clinic when I was running it, as well as other clinics, that people are getting all the right stuff. They're winning against a very aggressive cancer, but then still make a human error, and it cost them dearly. And they passed on when they really, I didn't see why that should happen. But here's one of them: taking time off when you feel better. Here's why. Cancer never takes a break. It's got one outcome: kill the host. That's it. It's a war. I had a integrative doctor tell me that one time. Rusty, it's a war. You don't let up. So when a person starts feeling better, we've successfully killed off the overburden of the easier cancer cells to kill. The lesser burden of the tougher cancer cells to kill still remain. But since they're not burdened by them, they feel so much better. I'm going to take a break. I want to take time with my family, because predominantly that's what comes. I hardly ever have a person say, I feel better, so I want to further my career. No, I want to spend time with my family. But and I understand and I get it. I really do. I understand. But with technology, this could give us other options to not take a break, but still spend time with family. So consider those other options rather than in person while you're in a cancer program, because those cancer cells that are tougher to beat, they remain. And I had a good friend of mine, she came to the clinic and we were winning against a very aggressive form of breast cancer. And she took time off, and we're like, please don't do that. But she had a little girl, right? And I get it.
Yeah.
I get it. But when 2 months later, she came back to the clinic, and the cancer that remained was able to grab a foothold, and it was tougher. We couldn't get back the gains that we got, and we lost her. So she's my cautionary tale, and man, we wanted such good things for her, and she was winning. So let that experience be a cautionary tale to others. Taking time off when you feel good can be one of the pitfalls that human nature falls into. Another one is changing your dosages, right? I don't feel good, right? So I'm not going to take as much of it. This is a huge mistake. Talk to your doctor, talk to your care team about those negative side effects that you're feeling, because if they don't know, they can't help you. So there's a lot of times it's not just the therapy that makes us feel bad. It's also the fact that we're winning and those toxins are in our body and they make us feel bad. So it can be the fact that we're not feeling good can mean that we're winning, right? And it just doesn't feel like we're winning. So I caution you, don't change your dosages and without discussing that with your care team. And then I think one of the most important things is to be an advocate for yourself. Take a friend with you, take a loved one with you. Don't go to your doctor appointments alone. Somebody needs to be there with great questions, right? Because in the moment, I didn't remember to ask that. I didn't think to ask that. Also, get a second opinion.
Okay. Yeah.
And if you've got a conventional oncologist and you go, hey, I want a second opinion, they should have no problem leading to one. But if you go down the street, down the hall, and get another conventional oncologist, don't be surprised if you get the same advice. So
Sure.
if you're looking for something outside of that, then you're going to need to speak with a doctor, a second opinion with an integrative doctor, that can open up an entirely new way of being able to fight cancer and have a high level of quality of life. So if you don't know of a doctor that can do that and you want a second opinion, hey, let's have a quick conversation and connect you to one, introduce you to a doctor who can do that. Second opinion can really help.
So for anyone that might be going through a cancer diagnosis or someone in your family, Rusty's your guy. I would highly recommend you reach out to him to just get some, the depth of his knowledge in this and the assets he has at his fingertips are fantastic. And he can eliminate some fear you might be having as far as, and you're not, like you said, you're not against conventional treatment, but you have some offerings for what could enhance conventional treatment, in some cases replace conventional treatment. But your wealth of knowledge is such that you would guide someone down the proper pathway.
Absolutely, and thank you. Those are kind words. And yes, the fact is, if anyone in the audience that's fighting cancer or loved ones fighting cancer, I'm talking to you directly right now. We don't know what we don't know. And without that knowledge, it's hard to grab hold of hope that there's another way when we don't know that way exists. Right? It's just, how do we do that? So being in this and seeing my mom, I didn't know it either. But when we witnessed this, a miracle rooted in science, like, wow, we immersed ourselves and it changed our lives. And we became different people. Our careers changed, right?
Right.
To help people understand what these therapies can do. Now, it's not a cure. There's no magic pill. I wish there was a silver bullet. There isn't one. Not today.
Right.
Maybe in the future, but not today. But when we time and pair and sequence these therapies together, we literally increase their effectiveness. And wow, what a difference! To have quality of life. You fighting cancer, even late stage cancers, whether it's a solid tumor or blood cancer, metastasized to multiple places, there is still hope. If you want more time, this is an option to you. I would suggest have a conversation with a doctor. Find out what they can do for you. That's where it all really begins. You know, and just to have a conversation. If it works for you, great, take advantage for it. God bless you. If it doesn't, at least you know that it's there and you can start looking to incorporate that and be a better advocate for yourself. One way or another, I've found that everyone was benefited at some level. Everyone was benefited.
So, Rusty, what is the best way for someone to contact you?
I make it pretty easy. Brio Medical, B as in boy, RIO. Then put a hyphen there, and you're going to put those in the notes, I would imagine. But Brio-medical.com. My phone number's right at the top. Call me. There's a form there, and I got a special gift for you. I forgot to mention this earlier. For anyone that ever wanted to know what it looked like behind the curtain of one of these clinics, I have a 7-week care plan of a woman who came into the clinic, stage 4, left 7 weeks later, got a PET scan, all of her cancer's gone. It lists all the therapies she was given, the dosage, the time for over 7 weeks, and then I have a guide that goes along with that. That shows the reasons that so you'll know what she got and the reason the medical staff gave it to her. And what those health gains they were looking for over 7 weeks. So what a resource that is for you. If you come to the form on the website, brio-medical.com, and you fill out the form there and put care plan, and I listed that in the instructions right on the form so you can't forget. But put care plan in the notes, and I'll know that you want it, and I'll email it to you. And it would take a person months if they ever got to a level to understand that of what you can see in this care plan. So come on, it's a free resource there for anybody who wants it, but brio-medical.com. Phone number, form, it's easy to contact me.
Wonderful, Rusty. That's the care plan, I think, would be so so invaluable just to see what someone actually walked through and the steps she took and the outcomes she had. I think that would be very helpful for people to see that.
I've seen people that the care plan may be a little difficult to understand, but you can see it. Don't try to memorize it or whatever, but but you can at least see. But then the reasoning guide behind it kind of brings it together. You go, they did this, this, and this, so she could, over a course of a week, expect this kind of an outcome, right? And you're like, oh, okay, that kind of, you couple those together, they become a fantastic tool and can just zoom a person through a process of what is being done behind the scenes of an integrative clinic. Yeah, it's a great resource.
Okay. Well, thank you for your time today, Rusty. I'm quite sure that you have brought comfort and hope to someone that's listening today.
Awesome.
And so you guys go find Rusty. He's your guy to alleviate a lot of fears and give you some options at brio-medical.com. Thank you, Rusty.
Thank you. Before we go, I want to encourage all your listeners. It takes a lot of work to put these podcasts on and do that every week. So to say thank you to the doctor, hey, go give her a 5-star review. She's more than earned it. Absolutely. Go get a 5-star review. This is important, right? And it helps others. It helps others get confidence in her ability to help people. So please take the time to give her a 5-star.
Yeah. Thanks, Rusty. I appreciate you.
My pleasure.
A great day.
Thanks, guys. Bye.
Thanks for listening to Hormone Heroes. Take a moment to subscribe wherever you listen to podcasts so you don't miss the next episode. While you are there, help us spread the word by leaving a rating and a review. If you would like to share your bioidentical hormone story or need help finding a physician in your area, please email us at drkelly@hormoneheroes.org. That's DRKELLY at HORMONEHEROES.org. We want you to be a hormone hero.